All right, we'll go ahead and get started here. So welcome everybody. Again, my name is Thomas Holland. I'll be today's facilitator for part 3 of a webinar series we've been hosting for WIFM, or Women in Facilities Management. This is called Best Practices from the Facility Front Lines. Today we've got a great panel for you, and we're going to be talking about a continuing journey and saga of the facility managers as they've had to work through COVID-19 and the impact that it's had on everybody's business. A little bit of housekeeping. If you could please keep your computer on mute. We will be recording this session and posting it onto the WIFM website here in about 2 days. WIFM is a 501c3 organization started about 10 years ago to advance opportunities for women in facilities management. We work closely with other related organizations such as IFMA, and we encourage all facility managers to seek out their F&P and CFM credentials. Our sponsors for the webinar today, Apex Surface Care and Corporate Floors are founding sponsors. Apex is a national specialty surface care company and public benefit company that helps protect your most valuable assets. Platinum sponsor is SoftBank Robotics, manufactures the Wiz, an autonomous vacuum sweeper that is reinventing commercial carpet cleaning today. Gold sponsor is DPR Construction, a national technical builder specializing in complex, sustainable projects that utilize in-house expertise and a passion for measurable results. Bronze sponsor is Shaw Contract. Shaw is a leading commercial carpet and flooring provider, offering broadloom carpet, modular carpet tiles, resilient flooring, and luxury tiles throughout the world. McCloskey's HVAC is a 30-year-old national provider of HVAC and plumbing services throughout the United States. Again, just a couple of other housekeeping notes. When we record this and put it on the WIFM website, it's open to everybody. So you'll have a link to all of the recording and all the information that we post today. Please use the Q&A function within Zoom. Should be either on the bottom or top of your screen, depending on how you have it set up. And just ask questions there. We do have some questions that came through in the registration. We have quite a few actually, and we do appreciate the audience sending those in as you registered, and we'll be working through. In our first 2 webinar series, we spent a lot of time asking questions directly to the panel that were questions that came directly from the panel about what was important that they were dealing with as it relates to COVID-19. This webinar, we really sought out questions from the audience, so the majority of the time that we're spending today will really be an open exchange and dialogue, sharing best practices, what works, what doesn't work. So feel free to keep asking questions, and we'll keep throwing them out there. I'd like to introduce our panel. As in our last webinar, it's made up of facility management professionals that have both regional and national and international responsibilities in their field. These panelists also represent end users and third-party management companies. And we have 2 new panelists that we'll be introducing shortly. I'm going to ask each panelists to introduce themselves and just tell us a little bit about your background as it relates to facilities. Maria, would you like to get us started?
Sure, now that I found the unmute button. So good afternoon. My name is Maria O'Callaghan Cassidy. I'm the Senior Director of Operations for the Wharton School at the University of Pennsylvania. I've been at the University of Pennsylvania for over 23 years now, and I have almost 30 years of facilities management experience, including international facilities management.
Excellent. Thank you, Maria. Really appreciate your time. Sandy? Don't forget that you might be on mute.
Yeah, usually it's my mic. I mute, so I went direct. I don't know if you noticed, I went directly to that. Hi, I'm Sandy Heidstand. I'm the Senior Director of Global GWS and Real Estate Teams for Dolby. We are headquartered in San Francisco and have a global portfolio in EMEA, APAC, and the Americas. And
Excellent.
I'm happy to be here. Thank you.
Thank you so much, Sandy. Holly?
Yes, good afternoon. My name is Holly Rylander. I am with Hilltop Holdings. We are the holding company. We have a bank, we have a mortgage firm and a securities firm, and we are a shared service. So we take care of facilities for all of those companies. We're headquartered in Dallas, but we've got offices all across the country, and I'm happy to be here today too.
Excellent. Thank you, Holly. Holly's one of our new panelists, and we're certainly looking forward to your insight. Cami Yarbrough.
Hello, I am Director of Facility Support for JLL. We are an international company, but my specific area is in Texas, the area of Texas. I've had 12 years of facilities management experience and probably 3 or 4 years of property management experience serving clients in both the IT, technology, and cable industries.
Great. Thank you, Cammie. Appreciate that. Glad to have you on board the webinar and listen to your perspective as well. My name is Thomas Holland. I'm the facilitator. I'm the CEO and founder of Apex Surface Care and Corporate Floors and a WIFM board advisor. And glad to be here and thankful for the opportunity. We're going to jump right into the questions now. The first questions that have come through for folks, there's quite a few. And I did want, before we jump into that, actually, I wanted to share a little bit about WIFM. As we mentioned before, the focus is advancing careers and opportunities for women in facilities. WIFM is a 501c3 trade organization. If you have questions about membership or starting a chapter in your area, you can reach out to gethelp@gowifm.org or send an email to our amazing chapter administrator who's online here, Ashley Adams. And Ashley really helps a lot with all the back-end information and can get you information about WIFM. We have chapters starting throughout the U.S. and a lot of great momentum, and would love to share that opportunity with you. The best practices from facility frontlines. So what that means is we're all struggling with something that's new and something we've never had to deal with before. And really until March, we probably thought this year was going to be a great year, maybe February for some of us. And then COVID hit and our world all got turned upside down. So every company that's represented here and every company that's online has really had struggles and some great learning experiences and some really great success stories of how they've dealt with COVID. And the purpose of this series is to share in the success of those opportunities and really to help lessen the impact for others. So our first question to the panel is titled, "Whoa, what just happened?" About a month ago, there was a lot of positive energy in facilities because the rates were going down. The closing seemed to have the effect of flattening the curve that we're looking for. And then all of a sudden, really in the last few weeks here, it just seemed to get out of control. So a lot of the RTO plans that were about ready to happen were all shelved. And now everyone's trying to figure out, well, what's next? So the question I have for the panel is right now is what is the most important thing that you and your organization or your facilities department is either focusing on or planning for right now? I'm going to go in reverse order, and Cammie, I'll start with you.
So I think the first thing was catching our breath. After that, it's the iterative process, right? So we, some of our locations did open in a limited scope, so we're testing the RTO plan that we threw together to open up the spaces safely. But our main focus is on the employee experience upon their return. We did a lot of things that were functional, a lot of things that were focused on sanitation, signage, and social distancing, all of those things. But now we have a few more months, it looks like, that we can focus on the feel and the flow in relation to all of those things that we did, and then fine-tuning our rotational kind of scheduling and how we can get the employees back into the space comfortably.
Excellent. Thank you, Cammie, for sharing that. Holly, how about yourself?
Well, we were ready to go back, and we actually did go back at 50% for about 3 weeks, I would say. We had an A-B rotation schedule and started that in June, and then towards the end of the month we pulled that back. So right now we only have essential people going into the office. So we're trying to make sure that we have everything cleaned, sanitized. Like Cammie said, we've got signage up. We had done all of that in preparation for return to the office, and then we had to kind of pull it back. So the main thing we're working on right now is just taking care of the employees that do have to go in, the essential services, to make sure that they are wearing a mask in the space, that we're keeping everything as clean as possible for them. And then the other project we're working on is trying to figure out what we can do when we are ready to bring everyone back with either plexiglass shields, or is there some way to modify the workstations so that we can have people come in on more than just an A-B rotation.
Excellent. So it sounds like there's a common theme that a lot of the plans that were put in place were either just paused or backtracked.
Yes, for sure. We were ready to go, and then we had to we did pause and we kind of backtracked. So now we're back to just essential people in the office.
Gotcha. Thanks for sharing that. Andy, what about yourself? What's the most important thing that you and your company are focusing on right now?
I think I'll answer from an Americas perspective, because APAC and EMEA are a bit ahead of where the Americas is, but we have a lot of lessons learned from those components. I also think that companies who are headquartered in California seem to have a different perspective of how they are looking at things and across their portfolio, and that is ever changing. I think one thing we can all agree on is being nimble is probably key in all of this, because what you think you're going to know and going to do today could change tomorrow, whether it's due to compliance requirements or we're learning as we go in these new territory. I think that communication is key because tracking compliance over a global footprint with updates, communication, alignment with our incident management teams, with key stakeholder partners, with employees, that, as I'm sure we'll talk through today, can get very complex and very time consuming. Being prepared to dial back very quickly and move forward. So this is not something that just has a forward motion. It can go in both directions. So we're planning for offices being at varying stages as well. Not everyone moves in the same perspective. And then research and discovery of trends. We are starting a piece of our team is looking at what's the research and discovery and trends of both workforce and workplace changes post-COVID. So there's a small group that is actually looking more forward perspective on changes in the workplace around that and workforce. While there is another piece of the group which is really focusing on today and tomorrow and what we need to be prepared and equipped to do.
Excellent. It's great perspective comparing the U.S. You mentioned that in San Francisco or California specifically, there was a different perspective. How would you define that perspective as California facility managers approach it versus, say, someone else in the rest of the U.S.?
Well, California has been based on local jurisdictions. We haven't opened up in the community, and that is really can change how companies, what we recognize companies look at. So as an example, if restaurants are opened and shops are opened, or if you need masks or don't need masks, that differs state to state, actually city to city. And so when you have a company that's headquartered in an area that is probably a little more conservative, what I found with talking with some of my colleagues, it doesn't mean that it's a one size fits all, but you do have a lens that you're looking at it just in case. What if that site actually has to roll back? Are we prepared, or do we have those plans in place? So I think that the same thing applies to somebody who is in a different position, and maybe there's a lot of people here from Texas, and so you're probably looking at it from a little bit different lens than maybe someone from California. Talking to my colleagues here in the Bay Area, you know, in the very early stages, and some people can take a look at it like from the lens that they are, but I think you have to be able to be open and see what's happening locally within the community. And for us, we really do, as I think Cami mentioned, you know, employee sentiment and communication is paramount, right? Mm-hmm. And taking care of our employees. But it's also connecting with site leaders and leadership locally within offices. So if someone is in Texas, you want to check in with them. What's happening within your community? We have a legal perspective that we have to monitor what's required legally or from a jurisdiction perspective and compliance. And that's in place. But I think staying connected to, if you have a portfolio that's it's in multiple states or multiple regions in the world, making sure you don't just have one lens, you have multiple lenses that you're looking at, because this is not a one size, one plan fits all. You have to be able to have parts and pieces you can use as you need to.
Sure. Well, thank you for that perspective. Maria, how about yourself? University of Pennsylvania, and what's new in your world, and what's the most important thing? You have a different market segment than the rest of the folks on the call here, and how's the university looking at this?
I think the University of Pennsylvania and the Wharton School is in the same boat as other universities across the United States, is that, we're preparing for some sort of a hybrid model, but at the same time doing a parallel plan for all online, because we just don't know what the future might bring. So we're doing double duty. The focus, I know, across the board is just on a safe re-entry plan. You're introducing students from a lot of hot zones that are going to be coming to campus, and how do you do that safely, and then ongoing testing and making sure that social distancing is adhered. And then it's really the scheduling and making sure that the flow within the university itself to get students from class to class and into their residence, but also into every individual building, which there's many of, also allows for safe social distancing and flow. And I'm not sure if other people have had this, but we have had to revisit the definition of essential worker numerous times over the past 6 months. So I think that folks' perspective on what's essential and not essential is ever evolving. So I think this is going to be part of the ongoing discussions that we have, because we do want to limit how many people are on campus so that those that have to be there have a safer environment. So that's going to be the real challenge. So I liked the fact that Sandy said that you have to be nimble. I like to say we have to be bendable but not breakable on a day-to-day basis. So it's just, again, just being open and being flexible for sure.
Maria, you mentioned that your definition of essential worker has been revisited. Do you find that pool and that definition is tightening, getting smaller, or is it getting bigger?
It depends on the situation, and that's what makes it so odd, right? Depending on, in our perspective, like what in our particular situation is, what particular classes are being offered, and then what level of service is really going to be expected, and so it's realigning expectations and then defining how you can get to those expectations that everybody agrees on. So it's almost like negotiating new SLAs, service level agreements, across the board for everything. Right. And so that is really time consuming, because as we move through this, everybody's going to say the devil's in the details. It's just when you think you've addressed one thing that has tentacles that touch another 20 things. So I think, again, this is whatever our future is going to be. Nobody has a crystal ball, but I think these discussions, to Sandy's point and to Holly, and also what Cammie says, that we're starting those discussions now, which I think are going to define where we're at a year from now and then beyond that. So there's just a lot of talk.
Bendable but not breakable. That's a great takeaway for this first segment. Thank you all for sharing that. So we're going to jump right into audience questions. And again, just for those folks that have jumped on, if you use the Q&A feature, we have several questions that were asked during the registration process, and we're going to start with some of those. But there's some related ones here. And then one technical question that just came up, a lot of folks are dealing with, or facility folks are dealing with, putting up partitions and plexiglass. And one of the questions is, what's the recommended height between the seated employees as they sit across from each other, or in a call center or in an office space? So if you're wanting to extend the height of that station, what is the recommended height to ensure perhaps the safest level of social distancing there? Anybody want to jump in on that one?
I'll just say that we've done some research, but every time we think we're about to have a plan, then we get data from the CDC or other agencies that, okay, well, maybe actually that's not the case. It can actually travel the virus can travel in different ways. So we're taking a very precautionary approach. We're making sure that employees have enough distancing and PPE. And the one area that we are, and in some cases it's a compliance requirement in some cities, which is we do have those guards at all reception areas. And I'm sure that's the case across. I can see Cami nodding. But I would say that we're just, because we haven't rushed to do it, because we want to see really what does all this look like from a kind of the medical compliance side of this. They don't really know a lot about it, but they know more than they did, but we'll know even more as we get closer to really some serious occupancy within our workplaces.
For certain. Holly, you had looked like you might jump in on that one. I'm going to volunteer you to provide an answer if you don't mind.
That's fine. Yeah, we've actually been having that same discussion over the last couple of days with my team. We have some office space with newer cubes, newer workstations that are sit to stand. So then that gives you a whole other issue. You have to make sure that when you stand up, you've got enough coverage if you and your neighbor are standing, that you're not, looking over the side of the wall and able to interact that way. So we haven't really come to that conclusion either, but we're thinking as long as it's, between 6 and 6.5 feet if you're standing, so that would cover most people if they're standing at their desk. That's kind of what we're going for, and that's what we've tried to quote. So we've got a few different options. We've got some that are movable so that we could move them around, and then we're looking at permanent changes to the workstations. How would we permanently change them to make sure that their height is appropriate? Because these were new remodels, and so the thought process before this was sort of lower walls and more people closer together, and so now we're having to rethink everything. But that is a good question, and one that we're trying to kind of answer as we go along also.
And there's some great resources out there from both the furniture manufacturers, from the architect and design community. WIFM has a resource center right on our homepage, gowifm.org. Also, IFMA has a great resource center. All the industry trade articles, guidelines, they're all posted on both of those websites, and we encourage everybody to take a look at that as well. Which brings up another question from the audience that was on registration, and actually it came up just now as well. So one of the roles of facilities is to walk around a lot and check the building out and respond to questions and look at these workstations that we're trying to redesign. What happens if somebody from the facilities team gets diagnosed with COVID? How do you treat that as an active case in your company, in your facility? Who'd like to raise their hand on that hot topic?
I can let you know what we our mindset is. Our EH&S team is very focused on any time that we have a chance, not just a positive result, but if there's a chance that someone who has contracted COVID has been in this space, then we do a backtrack of what areas and spaces that person was working in. And we've got different levels of sanitation that have to occur, right? If the person is wearing PPE, which they should all be, then we have the touch sanitation, which is any area that is any high touch area or any area that is within the level looking surface. If it's in a situation where they were in a space where they weren't wearing a mask, we have electrostatic, cleaning, where we have to make sure that we get high points and high touch. So I think a lot of it is situational, but mostly all of the time we do a backtrack of where that person was working. And if in our environment, people are assigned certain areas, they have different floors, they've got, so we can pretty much gather where they are, and then we've got a elevated level of cleaning that's going on all the time so that there's a minimal risk if there was somebody that was in the space.
Gotcha. So what I heard, Cami, was kind of a three-legged stool. There's already enhanced cleaning happening daily, And then if the employee was wearing a mask inside the office at all times, then you would disinfect from a touch standpoint. But if they weren't wearing a mask, there's a lot of employees that do and don't, then you would move to more of an electrostatic applied disinfection. Is that correct?
Okay. It's all a matter of level of exposure, right? So if it's, and depending on what that employee is responsible for, or if it's our janitorial team, we know they're wearing PPE, but we also want to make sure that we spend most of our time in the common area spaces where they currently are. If it's a facilities crew, they're typically in the storage rooms, conference rooms, right? So you want to make sure that it's specific to the area that they would have been in, and then pay special attention to those spaces.
Got it. Thank you for the feedback. Anybody else want to jump in on that one? So another related question. So the CDC, if you read their documentation, there's a pretty general, very general guidelines about cleaning and how to disinfect spaces. And they don't really talk specifically about the type of disinfection. So the question in the audience was related to deep cleaning, terminal cleaning, disinfecting. CDC guidelines say to disinfect, but they don't talk specifically about how to disinfect, such as electrostatic or whatnot. So when there's a case of COVID, how is your company addressing it? Not just if a facility manager or facilities team member is diagnosed, but just any employee is diagnosed. How are you approaching that if it's any different than what Cami had mentioned? Holly, do you mind jumping in on that?
Sure. We're basically following the same guidelines that Cami just discussed. If anybody tests positive, then at that point, we're actually working with our HR team to kind of backtrack and find out when was that person last in the office, where did they go, who did they have contact with. That's another thing that HR helps with. And they've actually come up with a log for like my facilities team to use whenever they do go and visit a site. We've got a lot of bank branches that we take care of. So if one of my team members goes to a branch, then if they log that, if somebody at that branch gets sick, they can backtrack to my team and say, well, when were you there last? And see if that person might possibly be affected. But as soon as we find a positive case, then we're going in and electrostatic cleaning if they've been, throughout the space, if they're not wearing a mask, if they haven't been social distancing, that kind of thing. If they haven't been in the office for a few weeks, then we're notifying everyone, but we may not clean, we may just clean the touch points, which we're doing nightly anyway.
Gotcha. And Holly, when those notifications go out to other employees, and correct me if I'm wrong here, but if there is somebody that has a active case in one of your buildings, do you notify the rest of the employees, and then do you also notify the vendors that are working in the space?
We do, and we actually right now are not allowing vendors in our space. So there would be very, very few that we would need to notify if we have a positive case.
Got it. Got it.
Thomas, on that note, I would say that contact tracing, again, some of this is compliance depending on what city you're in to have a plan. But I think one of the really important things is having the protocols and plan, the actual written plan of what is your process for contact tracing, and then if there's an on-site case, and then the response for it. And I would highly recommend that you exercise your plan. We actually did that, and we had a lot of opportunities to learn from that, and had some really good constructive views on what we thought was a good plan. Because as we know, exercising your plans, one, creates the muscle memory around who has what role, how quickly things can turn around, communication, who can decide, who makes decisions on if something doesn't fit quite within a box in the plan. If it's outside of that, how do you resolve it? it was a really useful exercise for our team. And we're going to be doing test exercises on a regular cadence for all of our different plans, because many of us, I'm sure, have different plans in place, whether it's an on-site and contact tracing versus having to roll back. I think going into contact tracing and an on-site case is how soon after you have recognized that there is an on-site case, what are the guidelines to shutting down those spaces? How do you clear out if people are already working in there? How do you know who's in the building, who communicates it? Like, there's a lot of small tasks that need, and important tasks that need to happen that don't always sit within a plan, because they're the things you do to comply with that or to get that plan moving or in motion. So again, I would just exercise your plans, even if it's not a full with your cross-functional IMTs. Maybe it's only just the facilities team does theirs. You don't want to practice when it's a real time.
Good to know. No different than an active shooter plan. I think anything that requires a lot of communication, you certainly need to practice that.
And I did want to add just one thing, Thomas, because we've been in an actual and a test situation, and what we haven't mentioned is the partnering with our janitorial and cleaning vendors on knowing what cleans what. What does disinfectant mean? Just going back to that last part of the original question. Do we need 70% alcohol content? Do we need 60%, right? We're not all working in hospitals, which is where a lot of these disinfectant timelines come from. Does it need to be on the surface for 10 minutes, or is it kill viruses on contact? So we did a lot of work with partnering with our cleaning vendors who have the MDS books on, SDS sheets on all of the different cleaning and disinfectants, and making sure that we are leveraging their knowledge for how do we disinfect the furniture if there's a case? How do we disinfect the carpet? How do we make sure that when we do that electrostatic spraying in the cafes, that it's not going to cause another problem if we're doing packed lunches or whatever? So I think it's, yes, we have a plan, but we also need to check it against people who know more than we do. And when it comes to cleaning, we partner with our vendors and really have those conversations and ask them based on their historical and just expertise. What is it that we should be using to clean and disinfect with the maximum impact, and how often should we be doing that?
Yeah, that's a great point, Cammie. And I'd add too, it's important to make sure that your vendors actually have the experience, because I'd say 90% of the folks out there really didn't know much about that until March, and when this became an issue. There's some great companies that do have that experience in that space, or they have a trusted consultant that they could work with to help that company learn. Also making sure the company gets their employees all the way down to the field level, the proper training on how to apply the disinfectants, because there is a proper way to do it for sure. That's great feedback. Maria, from a university perspective, how are you addressing that? Because you've got a little bit different environment where there potentially could be students, and what's the plan look like if there's active cases with both the staff versus students?
Well, there's a source tracing committee. So it's made up of medical professionals as well at the University of Pennsylvania. And we actually have a pass system that you have to fill out a questionnaire each day. So both faculty, staff, and all faculty, staff, and students have to fill this out before they can enter any building. And it asks you general questions about, what's your current condition? Do you have a temperature? Do you think you've been in contact with anybody with COVID? You get a pass, and then you will show that for entry into the buildings. But if there is a case, then the source tracking group or investigative group will then investigate, and they'll make the contacts themselves, right? Depending on, the scenario of where this person or individual went, people might not ever be notified, because if we're managing with social distancing 6 feet apart, we have to wear masks the entire time you're in any building. In fact, Pennsylvania now has the rule that you have to wear your mask even outside, right? Mm-hmm. So, there is there is limited transmission if you keep that mask on, right? So they'll make that call from a professional standpoint. But we have great partners with University of Pennsylvania housekeeping team, and we have protocols in place to disinfect. And one of the things that we've made sure of is that as we enter the fall semester, if we do a hybrid model where we have in-person classes, we were able to get a free period in between every class. So that means that there won't be classes back to back in the same room, so that we can go in and disinfect the spaces. And you have to be very careful, because one of the things that I've seen a couple people do now is that they're bringing in straight bleach from their home. And that's just going to destroy your finishes. You don't want that on your carpet unless you have solution dyed carpet. And, and so you want to encourage people not to bring in their own homemade brews to clean things, and that you really share what your program is. So we use a chemical called Virex that has a 10-minute dwell time that we found to be, very effective. So we have to make sure that we have that time frame to clean the areas, especially restrooms, right? So there's the ones that are going to be, they're the ones that I think are going to be, the restrooms are the biggest challenge that we have, because to properly social distance in the restrooms, you're going to not have every stall open. You're not going to have every sink available. So you're still going to have a population within the building, and you're going to have to cycle those folks in and out, almost like a concert. You have a break, they've got to go in, they've got to leave and go to the next class. So I did see something pop up in reference to one way in and one way out of the buildings. And yes, that's one of the procedures that we are doing at Penn too, is that because we don't want to be salmon, we don't want to be swimming upstream and potentially like banging into folks. So, we have a designated entrance and exit to all buildings. So upon entry, you're being checked to make sure that your pass is filled out, and that you have a purpose within that facility. And then there's going to be signage to direct you to exiting that building from a different location, so that you can keep, social distancing within the hallways and spaces.
Great. Thank you, Maria. I appreciate that. Many of you mentioned contact tracing in your facility, and is that managed by HR, by facilities? And then if it's managed by HR, has anybody run across any HR legal hurdles with regards to information or any other issues? That was a question from the audience.
Ours is run in conjunction with our environmental health and safety group and HR. So those two groups partner together to make the initial contact with the person. Once an incident has been reported, they will ask questions with HR representative, so that they're not asking questions that they should not ask, but mainly just who they've been in contact with. Were they socially distancing when they were around those people? Were they wearing PPE? They're asking general questions to find out the level of risk to the individual and to other people. But that is outside of the facilities group. And then once they make a determination on, they will make communications to the other employees if there are other employees infected. And then we simultaneously are taking the ownership of making sure that the space is sanitized and is safe for people who are going to remain on site.
Great. Thanks, Cami, for that. One topic's been discussed a lot is UV lighting, and also modifying the HVAC systems with UV. Curious to know if anybody has done that within their systems or considered it, and what do you feel the pros and cons are to such?
So I'll take that. I think the UV technology is new and extremely promising. From a classroom standpoint, you would have to have fixed UV. I'm not talking about the kind that goes in the HVAC system, which the jury is still out on that. I think there needs to be a little bit more studying there. But the UV technology, the lamps, you'd have to have fixed lamps in a tiered classroom. Now, if you had a flat space, there are UV robots, but they're extremely expensive. They're about $100,000 each. There's a slight discount if you buy multiple units, and then they'd have to be mapped, right, to know where to go, essentially program them. I think for office environments in certain situations, they're a great alternative to cleaning, absolutely. But the lamps themselves, you have to be super careful that nobody's in the space when those lamps go on. And depending on how high the ceiling is, you're going to have to leave those lamps on for longer periods of time, because within 3 feet, it's like 75 to 100%
Right.
effective. But when you start talking about them ceiling mounted, and it might be 6 feet, 8 feet, 9 feet, 10 feet, 12 feet, you're going to have to figure it out, right, and program it. So you might not have the best coverage by just doing the permanent install. So it's something that's evolving, and it'll be great to see in 6 months from now what else they come out with. But from a safety standpoint, I think you have to be very cautious. In reference to ASHRAE standards and HVAC, I think that wherever you have the ability to manipulate the programming of your system to ensure that you get more fresh air exchanges, you should do so. And you can do that even with an aged system pretty well, as long as you don't have design days, like beyond design days, like super high humidity or super cold. If you're kind of in the middle, then you should try to increase those fresh air exchanges. The other thing is, I would encourage people to work with their engineering department to take a look at your systems, and if they can take a MERV filter that's a little bit higher, maybe in the 15 to 17 range. Above that is HEPA, and unless you have the properly sized ducts in the type of system, you do not want to put a HEPA filter in if the system was not designed to do so, because you can destroy it. But you know, there's a lot of, if you've recently gone through an upgrade, most likely you can increase your filtration grade, and it can contain a lot more particles, capture a lot more particles, and that's what you would want to do for at least during the next year or two after this. So those are just some things to investigate.
For certain. I know in our last webinar, HVAC was brought up as well, and there was a cautionary tale about increasing your or putting on higher grade filters. If your HVAC is not designed to handle those, you can kind of exacerbate the problem and frankly create a bigger problem. So we do recommend you certainly work with your HVAC contractor, make sure your system can handle increased filtration on the unit. Anybody have any other parting shots on the HVAC side of things? All right. One quick question that came up also is most companies seem to have a mask policy that requires the employees to wear a mask in the space once they get to their desk, and then when they're at their desk, then they can take their mask off. I'm generalizing, but that generally seems to be a widely accepted policy. But what if there are employees that don't want to wear the mask, or they can't wear the mask because they state they have a medical condition? How does the facilities team get involved in that discussion, or are they just pushing that discussion to HR? Holly, would you like to take that? Oh, go ahead, Cammie.
I was like, that was two. Yeah, that's fine. It's two parts. One, the understanding if somebody has a medical condition where they cannot wear a mask. For us, we would be having the discussion of whether or not during this phase we would recommend that that person be put on a work from home rotation, because we don't want that person to contract anything, especially if they're already high risk, and then adding not wearing a mask. The other thing is, when you're in a space, whether you're sitting at your desk or if you're sitting in a conference room, if you could potentially be around other people within that 8 meters, you should be wearing a mask. We encourage everyone on our locations to wear a mask unless they're eating or drinking, and or if they're in a conference room by themselves.
Got it. Thank you. Thank you, Cammie. Holly?
I would say if we find someone who's not wearing a mask, that usually is something that HR handles. But one of the things that we did is we've limited the number of people who can sit in a conference room to hopefully, well, first we've told everyone to make all their meetings online. But back when we were actually thinking we were going to open back up at 50%, we had removed a lot of chairs from the conference rooms, and we had signage up that you could only have like a maximum of 5 people, no matter how large the conference room was. We are providing some backup face masks. We're not providing them to everyone in the company, but we do have some, like in the mail room or someplace if somebody loses it or it breaks for whatever reason they don't have one. We do have a few that we can hand out to employees. So we're trying to help in that regard. But if we see somebody that's not wearing one, that usually gets handled by HR.
Got it. Thank you, Holly. There's several questions that are referring to just disinfection and electrostatic. One comment was electrostatic's expensive, so is your facility group doing that in-house, or who's doing that? If I can comment on that really quick, one, to just define what electrostatic is. Electrostatic spraying is just a method of applying a disinfectant through a sprayer. It's a different kind of sprayer. So whether you're fogging or using an electrostatic sprayer, the general population seems to like electrostatic simply because the spray cannot become airborne. It won't aerosolize like a fogger will. So it can't get up into the HVAC, which is a benefit, and also because of the charge, it can wrap. But also from a pricing standpoint, it is all over the board. And unfortunately, in times of crisis, the profiteers come out. And we've certainly seen that, and I know some of our clients have seen that as well. We consult with our customers and simply say that if you're paying more for electrostatic or any sort of disinfecting, and it's costing you more than what you would normally pay for carpet cleaning or regular maintenance carpet cleaning, and frankly, it should even be less than that, then you're probably paying too much, and you should find somebody else. Just be careful and make sure the companies that you're working with are qualified to do that. But with regards to that, there are a lot of different methods for doing it and different strategies. And I just wanted to see, Maria, you mentioned your team is using Virex, and are they applying that just through electrostatic? Are they using it just as a wipe down? How is your team using that?
It's a spray. You spray and you let it dwell on the surface.
Mm-hmm.
You have to be careful with some of the electrostatic products, especially around computers. So you have to know what you're doing. So basically everything's going to get touched. It's going to be a high touch process as we re-enter. So you're going to have more staff on during where you would, people, it's funny, before this, and I think a lot of people would relate that before this, they wanted their housekeepers to be like children, you know, seen and not heard, like they just want to see them in the background and then that's it. And so a lot of cleaning was done off hours. Now we're going to be shifting a lot of that cleaning with our partners at Penn to day shift so that they can, you know, repeatedly wipe down the handles and touch the restrooms. And like, instead of just policing, we're actually cleaning over and over and over again during the days. So it's going to be very labor intensive for the foreseeable future. So, you know, we have to just be careful and manage expectations as well and do what we can to help the housekeeping staff, because it's just you reach a point where it's not sustainable to keep up with that level of cleaning, right? So people have to take some personal responsibility as well to wipe down their stations. But some of the things that we've done, I think, to help housekeeping, and this might be a little off topic, is that we've banned all eating in our buildings. Like you can't come in with a cup of coffee. You know, you can have a glass of water, like a bottle of water in your bag, but you're gonna have to exit the room to take a swig. Like it is, you know, we're laying down law. We've closed down the cafes in our building, and staff are encouraged and faculty are encouraged that if they're going to be working past their lunchtime or over a lunch period, that they bring snacks or food with them and that they go outside to eat. And the university is providing exterior, like covered exterior spaces for breaks. So we're really pushing that mask needs to stay on the entire time that you're on.
Yeah,
Great.
Thomas, something that Maria mentioned. So we have labs in our spaces for engineering, and what we learned very quickly is electrostatic spraying cannot be done in labs due to the technology and the equipment in those rooms. And so there's probably other like rooms that this would apply to, server rooms and the like. And so we have a whole different protocol in labs in case there is a confirmed case in a lab. Also, the other thing that we recognized quickly through, it was actually someone on our team or in our company who read an article about this, but depending on what's happening in a lab and what's going on, the regular antibacterial wipes that we ask people to kind of clean their desks and clean up before and after, we don't use those in our labs because of the flammability of them. If somebody's there's a soldering station, like we're not at that stage yet for our occupancy, but we are, again, pre-planning about what the protocols are for our employees from a health and safety perspective. So we shifted to a different protocol with how they self-sanitize before and after a use in a lab. And then if there's a confirmed case, what is our protocol because the electrostatic spraying cannot be used.
Excellent. Yeah, we also recommend not to use it in server rooms or high electronic environments. General office space is fine. Where it's not fine is when it's improperly sprayed or improperly used because you can damage things. So good point, and thanks for pointing it out. One thing too, it's super important that facility managers really pay attention to what disinfectants are being used in their space. Just because it's on the in list doesn't mean it's safe. There are some really harmful disinfectants on that in list, and understanding what the HMIS rating is, the health material safety rating is, looking for products that are all zeros across the board, looking for products that are food safe. They do exist and they are on the in list. So real important to understand what's being used in your facility. We're going to take a step back and look very strategically at this situation because there's been several questions are really looking at the long-term impact of this and the long-term aspect of what does it mean when workers are going to stay at home for months, not just weeks, as we all thought initially. In March, we all thought this was a 6 to maybe 10-week deal, and now it's really an unending with no end in sight. And so the question is, how have you and your facilities team either been instructed to, or what are you thinking about in managing the psychological aspect of a workforce that is working from home from a long-term standpoint? How is that affecting their productivity? And then how does that affect your ability to serve those employees, and what is your role in doing that? So kind of boiling that down to the essence, you've got a workforce that's sitting out there long-term now, not just short-term working remotely. How is that going to affect your facilities department? Cami, do you want to touch on that?
So this is a huge, huge question, but also critical question, right? I personally have a team of 40 people. Some are doing fantastically working from home and doing their projects, and there's others who are having that isolation kind of effect, and in the fear when they're isolated kind of develops into something else. But the first thing that we're doing to attack it, one, is being as transparent as possible. We are making sure that we acknowledge that fear of the unknown is real, and it can be physical and psychological. So we're spending a lot of time making sure that our teams are finding ways to be in a group environment remotely. We do a lot of T-chats, coffee chats. We're hanging out with each other on team meetings. We are doing a rotation where they can work in groups but socially distanced for a particular project, and then going back to work from home because our team is deemed essential. One thing that I was super excited about that JLL did was give the essential teams all a membership to Headspace, because meditation and finding peace in your mind is important. So we're trying a lot of things because this is new. Having those conversations, the leaders are doing skip levels to make sure that we're addressing all of the questions and concerns that people have about the long-term working environment, and showing them the benefits and the opportunities that we have right now to focus on our processes, to focus on the things that we typically don't have time to do because we're running around the office. So we're really focusing on the excellence of the things that we can touch while we plan for getting back into the space and having things really running smoother is our ideal.
Got it.
Yeah, and to add to that, I think that we're doing all of the very similar things that Cami mentioned, you know, and I think it's leaders staying connected with their teams and creating that camaraderie and synergy in a virtual way. It could be like we've got like share a picture of something that made you smile today. And it's not an everyday thing. Like at first it was, but then now it's like every week or so, somebody in the team globally is sharing a picture.
Right.
And what we're experiencing as work from home and how our teams meet, it's actually not unlike how you have a global team work together that are cross-functionally in different places. And that doesn't have to be global. It can be within the US or different offices within Texas. I think you need to kind of go back to those basics and have fun. Create moments of fun for everyone, whether that's a wind down at the end of the week or a virtual painting class. We might be doing that with our team. But I also think that HR and well-being team is doing a really great job of really connecting with people, because people have can have an impact to this. If you're a single person living by yourself, that's a very different experience in what you're feeling emotionally and psychologically. Is there's just so much in your house. Your roommates or your spouse or your partner and the kids. If you're a parent, you're having to homeschool your kids while you're trying to also work, and all of this coming in the confines of your home. And I think we are now living where we work. And that's a very different shift to what everyone has been used to. And I will say the one thing that came about is in the past, when you had some people in the office and some people remote, and you had your conference call, not everyone in the room remembered that everyone was, there were people that weren't in the room talking. But in this case, we're seeing, everyone's in the same playing field, and the productivity that we're experiencing, I'm sure many of you are, it's great and amazing. I mean, our teams are doing such great things in an environment that is all new, and the way that we're all approaching, I think video is also one of those things that up front we said be sure to have your video on so people can have that interaction. But there's also studies now that just say that can be an overload. So be careful that you don't feel like you have to be on video for every single phone call. And so I think what we were looking at several months ago, it's always good just every couple months, just self-check. How's it going? Is what you were doing to try to keep that synergy and camaraderie together and that effort together with your team collectively, is that working or not? Do you need to shift some things up?
Sure, that's great feedback. Thanks, Sandy. Holly, what about your team? How are you dealing with that remote aspect with the team and the psychological impact?
Well, like Sandy said, I do have several remote people to begin with. So we're kind of used to functioning that way as a team, and we are essential, but my team is on an A/B rotation right now. So where I have 2 or more people in the same region, they're switching out. So one will be in the office, and then the next week they'll go work from home. So, mainly just communication, making sure that we're having our meetings, making sure that we're all staying in touch as a group. And then individually, I meet with each of my team members once a week. And that used to be in person, but now it's either over the phone or maybe on some kind of a video chat. But I think just communicating with everyone and communicating everything that we know. If there's anything that we know that's going on, if there's information that we have that we can share, I think that's the main thing, is that people are just feeling a little bit in limbo. And I think the more information you can give them, the better they start to feel about this.
Great. Thank you for sharing that. And so while the employees are working from home, whether that's your team or the rest of the folks in the company, what sort of equipment and facility, what is coming from the facilities team with regards to furniture or equipment or chairs, desks, monitors, keyboards, all those things, and what's facilities' role in helping provide that to those employees? Sandy, do you want to jump on that?
I'm sorry, I lost a connection there for a minute. Can you repeat the question, please?
With the long-term stay at home, so what furniture or equipment are you providing to employees, if at all, working from home, and how is that affecting your ability to manage that?
So I think, like with many companies out there, we decided to give a stipend to employees rather than have them take equipment home. We've had a lot of requests, but there's a chair sitting there in the office. Why can't I take it home? But when you have a big portfolio, that would be a lot to manage of where components are, how do you get repairs done. So our approach has been to be more supportive with a stipend rather than, and also the other piece that has been really complementary to that is our ergonomic support. We very quickly ramped up an ergonomics program virtually for employees because not everyone has the same kind of environment as they get in the office. And then the other thing is that we partnered with our furniture partner to have a portal for employees to be able to go to and purchase anything that they may need if they wanted to do that. And we negotiated pricing and put a little catalog together as well.
That's great. Anybody else want to add to that?
I would just add, we did a blended. So there was a stipend because our environment is got our full-time employees and our vendors or TVCs where all of those they're not the same, right? Your FTEs versus your TVCs. So we did have where there was a stipend for certain equipment. The good thing is everyone was able to take their laptops home, right? Everybody's working with those. If they had a desktop monitor, when we initially went in March, they were able to take those with them as well. But we've been doing on the facility side a lot of shipping. We've been shipping out a lot of things, monitors, people with different webcams. Some of our engineers would forget that they had this trinket or that trinket that they were testing since the labs were closed. So we've been packing up and doing kind of EMT type shipping to help facilitate some of those things because for everyone to buy it may be cost prohibitive in some situations, or they're a unique item that they were testing or working on. So we've also added certain items for different teams. We will then go to their desks and pack up equipment that they were working on, things like that, and ship it to their homes so that they can be more efficient and effective at home.
Great, thank you. Again, stepping back a little strategically here, we're all hoping that at some point a vaccine comes across. Maybe it's next year, who knows? But I think that the general hope is that this will eventually dissipate and be minimized to where it becomes more workable and we can get somewhat back to normal. But the question is, has your team really thought about what happens if it doesn't? If COVID just becomes part of our fabric and we're dealing with it just like we do the flu, but the more destructive aspects of COVID being there every day. So what's the long-term impact, and has your team really thought about if you have to extend this current situation out, not just weeks, but months, what does that look like, and are you talking about that right now? Maria, I'm gonna jump down and ask you that question.
Yeah, that's a great question. I mean, I'm not sure if everyone has seen Zeke Emanuel's article that was published in multiple publications earlier this week, but he is predicting that we will not have any kind of normalcy until November of 2021. So this is for the foreseeable future. This is going to continue on. Vaccine or not, if we never get a vaccine, hopefully by then we have some, treatment plans. So, this is going to stretch on in some capacity. So we're going to have to be very flexible with how things progress, even into the spring of next year and potentially at the beginning of the summer of next year. So what we're challenging people to do is to just think through processes and procedures and how to save money, because listen, it's all going to come down to budget, and budgets are going to save people's jobs, because the reality is that there's going to be more layoffs if the economy stays stagnant the way it is, or we have another shutdown or rolling shutdowns across multiple states. And that looks like where we're going, even if it's just partial shutdowns in multiple hotspots. So what we have to do is have that plan of what projects can get moved, or put on the back burner? What is the most prudent investments? From a facility standpoint, you have to maintain your facilities. And I know it's not, I know it's not a sexy conversation to have with somebody to maintain your air handlers and things, but for everyone's health, you have to, and plus it's a huge investment. I mean, from a utility standpoint, poorly maintained buildings are probably the biggest cost absorbers. I mean, they just eat your resources. So, you know, it's making those strategic and right decisions and making the case for it and having a plan of where you can cut. Because we're going to get to a point where additional cuts are going to be required and we don't want to be scrambling. You want to have that plan on the back burner. In addition to just working, you want to make sure that people feel that they have the stamina, because things are going to be a roller coaster ride for the foreseeable future. And the previous question was, you know, how are you dealing with your staff and how are you staying in touch with them? And one of the things that I think that we have to start stressing with folks is to set boundaries. I think that, you know, being on video conference calls, and, you know, we have facilities in San Francisco, we have a facility in Beijing, China. So I'm always dealing with time changes, but the vast majority of the staff, if they're all working from home, there doesn't seem, boundaries have kind of like gone out the window. It's the people send emails at like 7 a.m. Why isn't there an immediate response? I'm still chatting with people at 11 o'clock. So I think that we have to just make sure that we're pacing ourselves and that we're giving people the opportunity to even think productively about what the future might hold for us. But to that end, you know, maintain your facilities. And I would just caution against making drastic changes. And I keep pushing back on administration that, you know, this isn't to throw the baby out with the bathwater. I think we just don't know what the future is going to bring. So let's make the prudent decisions today about what we can control, and let's just wait and see. I think a lot of it is a wait and see approach to where we're going to be. Because listen, there's going to be a desire once this thing starts to wane. People want to be with each other, you know, so rearranging entire office space where there's no cubicles is probably not the best investment at this time. Right now, you should probably socially distance, limit the amount of people that come in. That's not to say that the workforce is going to change and how we do business is going to change, but you know, it's not going to change so much that people aren't going to want to be in the same room with someone else. If anything, it's going to be more of a desire for that once we can get back to some sort of normal.
Right. Thank you, Maria. Maria, there was a request from several folks. If you could type in the chat on the Zoom the name of the article that you referenced, that would be helpful.
Actually, do you want me to forward it to you at the end of this? Because I can't type right now because I'll knock my monitor over.
No, that's fine.
But I'll actually attach the article and maybe you can send it out to all the participants today.
We will do that.
Yep, great.
Thank you very much.
Thomas,
Holly,
I just wanted, I wanted to, Maria had mentioned something about the tough conversations, and just the other thing that when we're talking about the long-term impact, leadership in all organizations right now are having tough conversations around acceptable risk. Because if there's no vaccine, or if it's a long time before we can foresee there's going to be a vaccine, there's going to be a conversation of, okay, what amount of risk can we accept so that we can get business done? And no one wants to talk about that, but the leaders of organizations are having those conversations, and they're a big part of the RTO plan, which is why there's phasing, which is why there's, you know, we're doing all of this preventative things, because we do understand that at some point we will need to get back to work. So as you're thinking about the long term and what do we see in the future, we know that janitorial standards will remain increased for the foreseeable future. We know that. That's something that we can count on. But what other things and how we're planning new spaces and new buildings, and I mentioned that because we're building 3 right now, trying to look at what do we do for the office space, and how should it look if we're building it now, not knowing what's going to happen 3 months from now. So that level of risk that you are willing to assume is a big part of that tough conversation.
Great feedback, Cammie. Holly, how's your company looking at that? So if this goes long term, How does that change your model, if at all?
It's hard to say. I mean, if it goes long term, I think, you know, the desire would be to at least get back to that AB rotation schedule that we tried to implement in June. Whether we ever go from that to the next level, which is everybody back in the office, you know, we'll just have to kind of wait and see what happens. But I think as far as facilities goes, our main focus has to be keeping the facilities clean. And to that end, we're working with our procurement team to see how much of this PPE can we find, what can we stockpile so that we can have it available when our branches need something, so we can send it out. We've kind of become like the central repository for hand sanitizer, wipes when we can find them. You know, a lot of it you can't find, so that's kind of an issue that we're working with procurement on. But I think as far as, you know, what's going to change for my team, I think it's just a heightened awareness of making sure that everything is kept clean, that everything is, you know, that they're still visiting their branches, they're still looking at what needs to be fixed, and none of that is falling by the wayside just because they're not in the office every week, but we do have someone there every week to take care of issues like that.
Good feedback. Many of you have mentioned having a response team, or everybody has an acronym for their team. In general, who sits on that team? What are the job titles of the people sitting on your response team? Sandy, would you like to touch on that one?
Sure. So we actually, my team, I have EH&S and Emergency Management and Response as part of my org. And our team has been working on COVID response since probably January, because we have offices in APAC and 3 in China. And so we quickly developed what we call incident management teams, or IMTs. And we have a core IMT, which is a combination of representation of legal government affairs, HR, internal comms, and facilities, or in our case, it's called GWS. And these are leaders within those organizations that are really tapped from a response perspective. In addition to that, we have regional IMTs, and one in APAC, EMEA, and the Americas. And we all meet at least on a weekly basis with all of those. There's a lot of meetings, but it allows us to be able to take a global perspective as well as getting down into a region, and in some cases a city. It allows that conduit of communication and making sure that we're on the same page. In addition to that, we have what's called an enterprise resiliency group, and that is a representation of key of leaders of all the business groups within. So they have their own track of what they're looking about the business impact. My team actually attends all of those meetings. Not everyone attends all of those meetings, but I think in that structure, I would say our closest partners are probably HR and legal when we are looking at anything in particular. And we also have a process where our team, obviously a lot of us are experiencing in some cases where your team is the one that has you say whether it's a green light or not for an office to go into a next phase, because you're the ones on the ground doing it. But we actually have the legal team do a quick oversight check to us to make sure that we are actually ready. So it's not our own filter looking in at saying we are. So we have a pretty good process in place, as well as the collective groups.
That's great. It sounds like you've really done a great job in testing those various scenarios that have come up with the team.
Yes, absolutely. Yeah.
Great. Holly, do you have a response team, and who's part of that response team with your organization?
For our organization, it's basically facilities and HR. So if we have a positive COVID case, the first people they reach out to is HR. Then HR is reaching out to facilities after they've done their contact tracing and talked to that employee. We also partner with procurement, like I was saying before, to try and find as much as we can, like supplies, PP&E, anything that we can have on hand for the branches. And then, you know, proactively, we're working with, we work closely with HR, and they're working closely with company leadership to kind of try and drive what are our next steps, what situation are we in now. It's ever changing, so how do we kind of move with it when it changes? So that's kind of our response team.
Great. And kind of tying on top of that, have you all felt that this whole situation has helped elevate the visual of FM and the appearance of FM and the response of FM and the importance of FM within your organizations? And if so, how so? What kind of feedback are you hearing from leadership within the organizations about the new role of FM, especially as it relates to these sorts of issues like a pandemic? Maria, do you want to answer that?
Sure, absolutely. I think that facilities managers suffer from oftentimes people think they understand what it takes to be a facilities manager, that it's, you know, unlike the technology group where they might not understand programming, there's a certain common sense they think that applies to it. And there's no doubt about that. But I think what this scenario, the COVID scenario, showed was not only is the devil in the details, that you need to have a competent group that understands the inner workings of the organization. And I think what it brought to the forefront is that the facilities teams probably know more about the organization than other divisions, because you're servicing the entire company, the entire organization. So there's an understanding to the work schedules, the staff, the operations within the building, whether it be mechanical or security, travel patterns, things like that. So now I've talked to other counterparts, and you're at the table. You're at the table day in and day out as a key member of these discussions. And unfortunately, you're often the ones that say, no, that's not going to work, and having to explain why it won't work. And so, yes, hopefully that trend will continue because it's elevating the skill set to a profession where I think before it was just a it was viewed as just maybe a task-oriented position in many circumstances. And now they're looking at, no, this is really strategic, and we need to talk about these things. And I don't know if other people have had this, but I had quite the battles about 2 years ago from a management standpoint, really pushing for a more robust HVAC upgrade for one of our primary classroom buildings. And, you know, they didn't understand. Now, COVID was not in my mind when I pushed this, but I think that it made made the most sense to spend the money to have additional controls available to us. But that has actually benefited us immensely now in this environment, being able to have additional fresh air exchanges in the spaces based on CO2 sensors. So, you know, it's that forethought of making sure that you have the flexibility and fighting for the things that you think are strategically going to help your organization. So I even think from a budget standpoint, that organizations are understanding that facilities plays a key role, and that decisions, it's not just a clearinghouse of, okay, I need to cut this amount of money. Guess what? You're not getting your HVAC upgrade. You're not going to get your bathroom beautification project. That's going to get cut off. You know, I'm hoping that this sticks long term.
Great.
That makes sense.
It does. Thank you. I've been having to shut my video off to save a little bandwidth. I'm having some starts and stops, so apologize for that. Cami, I'd like to direct that same question to you, since you represent third party, and I'm curious to know how an event like this has really affected the perception of your type of organization within the eyes of an end user. And just a quick note, we've got about 10 minutes left. So Cami, after this question, I'm going to move to the last round of questions for the team here.
Right on. I just want to say I've been getting a lot of this.
That's great.
If people can see, I think the best if we're going to say a best about this situation is facilities is notorious for being known as a cost center. We cost the company money, we don't make the company money. I think our ability to be incredibly agile during this situation and go from what we typically are known for, which is just proactivity, right? We're spending money and there's no tie-in for, you know, the business that's paying out all this money. I think that what we have shown from our RTO plans, the forward thinking that we are having in the social distancing and knowing directional signage, all of the things that we've been able to pull together based on this pandemic have more than shown companies what our ROI is. We are, as FM professionals, critical to disaster recovery, business continuity, and like Maria said, we touch every area of their business every day. So not only are we proficient in helping them to do their best work in a normal situation, we are also instrumental in helping them to get their best work done in a non-ideal situation. So I think I'm hearing a lot from our clients about the partnership and how invaluable it is to them at this time, because they don't work with facilities. They don't have the expertise to know what is it that we need to do and what is social distancing about and how do we keep places clean, right? That's where we came in, and we were able to alleviate a lot of that, the unknown stress, so that we could get to the planning and strategic functionality. So I think I'm excited about what's going to happen with facilities right now, and seeing how we are top posting on LinkedIn. For me, seeing it from everybody else's lens, talking about the good work that we're doing is super crazy exciting.
That's great. Excellent
Yeah,
feedback.
can I just also add, in
Please.
a time where this is not something any of us have done. So not only did you have such of a great baseline of, professionals who know their industry, they know the facilities side of all of this, and how quickly our collective teams have been able to turn around and have RTO plans and response plans and literally responding in a way that has really shown, I think, all the way up to executive and board levels within organizations. And I think that's just compounded because this is such new territory, and how quickly and professionally efficiency teams across the world have really kind of stepped up and been able to have that voice.
Absolutely.
Yeah.
I think there's a lot of company executives that are staying up at night being terrified, thinking what would have happened if they didn't have a facilities team, and how they would have responded to this. And facilities have become a real asset to the organization through this experience. Well, thank you all for that. We're going to move to the last question here. And this is really some last thoughts. We thought we were opening. Now we're not, not now anyway, maybe later. And we've referred internally to this as what we thought was going to be a sprint has become a marathon. Then the tape got moved about 10 miles back, and now it's an ultra marathon. So we're trying to run an ultra marathon with the mentality of a sprinter, and that can be a little challenging for everybody. So with that, and considering everything that you've talked about and are experiencing right now, there's tremendous experience sitting here on the panel and also online listening in. But just thinking about, you're sitting in a room with your peers, a group of friends that are all facility managers. What's the most important thing? What's the one thing that you'd really want to share with them that you think would be most helpful for them? So not just what you're focusing on right now, but really what's the most important thing that you can think of that would really be helpful for another peer or another facility manager to think about right now? Maria, I'll start with you.
Thanks. Geez, the one, it's really hard to come down with the one thing, but so I'm not going to say just one thing. I'm going to say three things. One is to keep your team engaged, and to keep their spirits up as this situation continues, because we need them. Not any one person can do it. We need our teams, and we need our vendor relationships. Even if we don't use our vendors that we used on a regular basis when things were normal, we need to maintain those relationships. So please spend some time doing that. The other thing is to always focus on safety, not only the safety of your team, but the safety of your organization, and be that watchdog. That is your role. That is your expertise. And then the third thing is just having plans to manage costs, because it's coming. Cuts are going to come, additional cuts. Some of us have already dealt with large cuts, but it's not going to go away. Better to be prepared and have something in your file that you think that is the best option for cutting costs, rather than being stuck in a situation where you're being told what'll be done. So it's being both prepared and not setting yourself up to be reactive at this point. So those are the three things that I would recommend.
Thank you, Maria. Those are excellent. I remember one other thing you shared in our last webinar was to make sure that you're clearing out your water lines in your facility, the ones that are stagnant. Otherwise, you're going to be suffering from Legionnaire's disease.
Yeah,
that was a good takeaway.
Make sure that, and I hope that people cleaned out their refrigerators. That's
right.
And to make sure that you're priming your drain lines, especially in cities, because you don't want any critters coming up. So
that's right. Yeah, we don't need another rat problem. Sandy, how about yourself? What's the one thing you think you could pass on to help a peer or another facility manager?
So I'm going to take Maria's piece here. I'm going to name a couple. So I think, as we all like to want to say, we should continue to be nimble and responsive, but that can really be depleting and tiring, and really can. So I think, take time to refresh personally. We're right now, everybody's in response mode, but we're really trying to figure out, how do you take some PTO? How do you take some days off to really kind of recharge and refresh? I think that's really important, and to celebrate your accomplishments. But I think when looking forward, really stay connected with your network and what studies are coming out. I mean, partners like JLL and CBRE and Cushman and professional organizations like WIFM, IFMA, Cornet, they're doing a lot to do research and best practices and trends and bringing that to ourselves and our partners. And I think really trying to stay connected with that and your own personal network. I mean, we're all in these new waters for us to navigate, but keeping abreast of information, sharing best practices and trends, being informed allows us to really think about what is the future of the workplace. One of the things we're thinking about is it a place only where people collaborate and they don't do individual contributing work? I think that the doors are really starting to open wide, and businesses are starting to think about what is the future of our workforce and our workplace, and how does that impact the facility teams and what they do on a day-to-day basis. Staying connected to that, in addition to the response, I think might allow some balance for the teams to be able to look forward to a future instead of one that is where we are right now.
Absolutely. Great feedback. Thank you, Sandy. Holly, how about yourself?
I would second all of that, especially the part about trying to find some time to take some PTO. Because I do think that everyone is just running around, and it does get a little bit draining when you feel like you're being so reactive. So anything you can do to be proactive is always good. But just knowing that your team is reacting to a lot, and they're having to react on the fly, and they're having to react after hours a lot of times too. So making sure that everyone is doing what they need to kind of recharge and take some PTO is important. And I think your vendor relationships are super important too, because I can't speak for anyone else, but I know that whenever we get the memo that someone has tested positive in one of our locations, it usually comes at 4:30 in the afternoon. I don't know why everyone seems to get their results at the end of the day, but that just, I guess, is the way it goes. So having really good vendors that you can partner with and call them at the end of the day and say, hey, I need to get this done tonight, and having somebody that can help you respond and react quickly is probably the most important thing right now.
Excellent. Thank you, Holly, for sharing that. Cammie, what about yourself? What's that one thing you'd like to share?
One thing, okay.
Or one set of things.
The most important thing for me and my team right now is to remind each other of what we're doing well what we are accomplishing and all of the things that we are learning right now and experiencing right now that are going to set this entire generation of FM leaders to the next level. Like, there is not another opportunity where we are going to get this kind of growth, kind of mental growth, I mean, and knowledge and learning packed into a situation. Not like we would have wanted it this way, but it is something that is giving us an opportunity to carry into the future and to really challenge future leaders as they're coming up, because we're writing the playbook right now. All of us right now in this environment are writing the future of facilities, and I think it's important to remember all of the things that we are doing. They're just fantastic, and sometimes in the doing and reacting, we don't see the 500,000 things that we just finished, right? So bringing that to the forefront and looking at it, this is what we did, can go a long way to help keeping your teams engaged and excited about moving forward, even though it's ambiguous.
Excellent. There's a great quote, Sun Tzu, The Art of War. Victorious warriors win first and then go to war, while defeated warriors go to war first and then seek the win. And what I heard a lot today was a lot of discussion around planning and seeking out best practices and testing your methods. And those are all best practices before you go to the war that we're in with COVID-19. So we really want to thank our panel today for sharing your best practices and your thoughts about how people can succeed in their facilities teams and their companies and make them the best place they can be for their people. With that, the WIFM group would like to thank all the participants that have listened in today. This is the third of a series. We'll likely have another one as long as COVID persists. There's always lots of best practices to share, and this is a venue and an opportunity to do just that and help elevate facilities across the country and across our world and across this profession with sharp people like we have on the call today. I'd like to thank our sponsors, Apex Corporate Floors, SoftBank Robotics, DPR Construction, Shaw Contracts, and McCloskey's. Most importantly, we'd like to thank you, the audience, taking your time to sharpen your saw, share your questions, and with the help of so many of your peers. And especially I'd like to thank our panel, Cami Yarbrough with JLL, Holly Rylander with Hilltop Holdings, Sandy Heidstand with Dolby Laboratories, and O'Callaghan Cassidy with Wharton Business School and University of Pennsylvania. My name's Thomas. I'm your facility manager. I'm your facilitator for today. And thank you again. We'll be posting again a recording of this video on the WIFM website in the next couple of days. We'll also be taking the transcript of this and putting it online as well into a series of best practice articles for everybody. So look forward to that. And again, thanks for joining us today.
Thank you.
Okay, we hang up now, right, Thomas?
We can. Thank you so much. Y'all have a great day. Thank you again for all of your time.
Thank you.
Absolutely.
Bye-bye. See ya.
Bye-bye.